Have you ever heard someone say they have sciatica? Chances are you have. The Cleveland Clinic says that 40% of Americans will experience sciatica at some point in their lives. Hi, it's Dr. Sarah here, your neighborhood physical therapist. I'm going to give you expert physical therapy advice on how to relieve sciatica pain. Now, if you've been watching my videos on back pain, you know that I always say that back pain is complicated, and as physical therapists, our exercise prescription depends on the cause of the back pain. So it's a good idea to seek out a personal assessment from your doctor or physical therapist. Sciatica symptoms are described as pain, tingling, numbness, or weakness starting at your low back and can go all the way down to your foot. Now, if you have a bulging disc, this exercise should make it feel better right away after a couple of repetitions. If it does not, you can move right on to the next exercise. So what we're going to be doing, I'm going to show you the side view, is we're going to be extending our low back, so you can put your hands on your low back like this, fingers down is a good position, and we're just leaning backwards, creating an arch in the back. Yep, so you can just hold it if that feels good to you, or perhaps the first couple times you're just doing slow repetitions of arching your back, leaning back a little bit. If it feels good to just go a tiny bit, then just do that. Or if you've been doing it for a little bit and you want to go back a little bit further, that is good too. So here's the figure 4 stretch in a seated position. So I'm sitting in the chair, on the edge of my chair, and say I wanted to stretch out my right side. I would just cross my leg over so that my ankle is resting on my left knee. And you might already feel a pulling sensation in your low back or in the back of your hip or your back of your thigh. And if you don't feel any stretch sensation in this position, you can always keep your back straight and lean forward to feel more of a stretch in that area. You can hold this position for about 30 seconds at a time is good, or whatever feels good to you. And then just return up to a neutral position. Bring that foot down, and then you can do the other side if that is helpful to you as well. Or really just the side that you have symptoms on, but it's a good idea to stretch out both sides. So you can hold this position for also about 30 seconds. And when you're done with that, just return your torso to the upright position and the foot comes down. Let me show you the figure 4 stretch done laying down. So if I wanted to stretch my right side, I would take my right leg and put it over my left leg. Both legs are bent here. And if I feel a stretch here behind in my low back or behind my thigh or my butt, that's great. If I don't feel that stretch yet, I can always take my leg where my foot is flat on the floor, and I can bring it back toward so that all my legs are coming up towards my chest. And I can hold this position for however long feels good to me, maybe about 30 seconds, and then I can let it down. And I can switch legs too. So my right foot is down, and I can put my left leg over, feeling a stretch there, or bringing my legs back towards my chest if I need more of a stretch. So in addition to that laying down figure 4 stretch, you can also stretch your knee to your opposite shoulder. So what you can do is, say if I wanted to do my right side, I can bring my knee up towards my chest, and instead of bringing my right knee towards my right shoulder, I can cross it over a little bit, bringing that leg towards my opposite shoulder, across my body, feeling a stretch in this muscle here in my buttock area. And like I said before, you can have the other leg straight if you want to, or bent, and just feel that pull for about 30 seconds if you can. And then you can just relax your leg back down. And I'll show you the other side as well. So here I am with my other side, knee up, and then I'm going to start to pull my left knee towards my right shoulder. Feeling a nice pull in the back of my buttock area. I am so grateful to you for watching this video. Please like and subscribe to this YouTube channel. And please leave me some comments. I love to respond to comments. And let me know what your experiences have been with back pain and any other content you would like to see in the future.